All right, glad to have you back. Now we know that hepatitis is one scourge that is really ravaging Nigeria. It's quite a silent killer, and a whole lot of people don't really know that it's a silent killer. So to talk about tackling hepatitis in Nigeria, this morning we have with us in the studio Dr. Biodun Ogungbo. He's the PRO of the Medical Directors of Nigeria, Guild of Medical Directors in Nigeria. Thank you for joining us this morning.
Thank you so much. Thanks for having me.
All right, now let's talk about hepatitis. Would you want to start by telling us about hepatitis and how it can be prevented, if it can be prevented at all?
I think the first thing is to let people know what hepatitis is. We have the liver in our body, which cleans out the blood and helps us remove waste products from the blood, and the waste is removed in the gallbladder, removed by passing stool. So you can imagine if your liver is not doing its job, all that waste stays in the body, and because it's in the blood, it goes straight to the brain, so it can damage the brain. So hepatitis is inflammation or swelling of the liver in such a way that it stops doing its job of cleaning out the blood and removing waste products. Okay. And there are times when I've been to Ijebu, for example, during the New Year, the celebrations, the cleaners and those who remove waste are also on holiday. So all the waste piles up on the street, and it's a big mess. So you can imagine if the liver is not doing its job, that's the kind of waste that will be retained in our body. Once you have that image in your head, you think, I want my liver to be working well. Yeah.
How preventable is hepatitis?
Well, what causes hepatitis? So many different things. So anything that stops the liver from doing its job can lead it to swell, because swelling is part of the way the body heals itself. But because of the swelling, then it becomes damaged. It damaged, then doesn't do its job anymore. So infection, which is the critical one, and the one we're talking about is viral infection, hepatitis A, hepatitis B, hepatitis C, hepatitis D. All those different viruses can damage the liver. There are other things, drugs, for example. If you take the wrong drug, it can actually damage the liver. Paracetamol, for example, which is excess of paracetamol, can totally damage the liver.
Wow.
So, but the key one is infection through viruses, and these viruses are preventable. And that's the key thing.
Are there age brackets that are usually, that can actually get affected?
It's a great question. Anybody can, at any age, can be affected by hepatitis. Even simply, if you think about it, newborn babies, brand newborn babies. We hear they develop jaundice. It's because the liver is not doing its job. That's this yellowness of the eyes in babies, which can then damage the brain of babies and lead to cerebral palsy. So right from childbirth, people can develop it. If you leave children alone, an infection in childhood, you come to teenagers or young adults, then it becomes sexually transmitted diseases. This viral infection that we're talking about can be transmitted through sexual intercourse. If you leave that age group and you get to older people, then anything can happen. The same viruses can affect them, drugs can affect them, the liver can just fail on its own anyway. So anybody can get the problems with their liver.
Now in Nigeria, what's the present statistics for hepatitis infection?
It would be nice if we know. We don't know. We estimate or we just guess that about 20 million Nigerians are suffering from hepatitis. And majority of the people actually don't know. And that's why when you say it's a silent killer, it's so true, because it doesn't give signs in a lot of cases. So for example, if somebody has an hepatitis infection today, in some people it may cause a fever, headaches, body aches and pains, and it passes off. You call it, or many situations nowadays we call it malaria, you call it typhoid. So you call hepatitis infection something else. So it clears off. In some people, that's the end of it. Their body mounts a strong immunity to prevent it ever happening to them again or causing trouble.
Okay.
In some other people, it kills them immediately because once the liver fails, that's sometimes it's the end of it. In a lot more people, this silent majority we're talking about, it just goes silent. It's still in the body, but no more signs. But then they can pass on the infection to somebody else through blood transfusion, through sexual intercourse.
Okay. Now, you mentioned that so many people are not even aware of this disorder when they have it. So what is being done to create that awareness amongst Nigerians? And how would you rate the response of the Ministry of Health to hepatitis scourge in Nigeria?
What has been done? I mean, that's one of the reasons why we, as the Guild of Medical Directors, have taken on the mantle, this battle of advocacy and, a huge outcry about, especially viral hepatitis. So we are, in the forefront now of promoting information and advice about hepatitis. And, we're going to push as hard as we can, with the support of, the press, of course, so that everybody in Nigeria, or, we get this information to the nooks and crannies in Nigeria, that hepatitis is with us. Hepatitis is preventable, and everybody must know about it. Whether the Federal Ministry of Health is actively pushing about it at the moment is a separate issue, because right now their major focus, of course, is meningitis, which is another horrible scourge, in Nigeria. So understandably, they need to focus on that. But, although we're also interested in meningitis, we know hepatitis is also there, and, we need to carry Nigerians along with that particular problem as well.
All right. Looking at the guild, what about the rural areas? Between the rural and urban areas, which is it more prevalent?
We don't have statistics, which is the honest truth. We truly don't know how many people are suffering.
Yeah, but from your own
hepatitis.
expertise, which of the areas do you think is most likely to,
But perhaps more in the urban areas, mostly, because of, being sexually transmitted.
Okay.
But also, if you talk about the rural areas, hepatitis A, for example, is transmitted through infected or food infected with fecal matter.
Okay.
And so when you talk about hygiene, maybe hygiene is better in the urban areas. Maybe the water supply is cleaner in the urban areas compared to rural areas. But the sad thing, of course, is in many situations, people are suffering from mild hepatitis or, hepatitis and calling it malaria, calling it typhoid fever. This thing about, resistant malaria, I've been suffering from malaria for so many years and all that kind of, diagnosis that we get. It may actually not be malaria.
But are they very open symptoms that people can readily see and be cocksure that this is
hepatitis?
Yes.
Well, that's the sad thing, because it's an infection like any other infection. So people get fever, they get body aches and pains, they get chills, they feel run down, they feel internal heat. Where it becomes obvious even to doctors is when there's yellowness of the eyes.
Okay.
Yeah, that points a finger directly at the liver, that the liver is not doing its job of cleaning the blood. That's when all this dirty material in the blood comes out and shows us yellow eyes. If we don't see yellow eyes, we may miss the diagnosis if we don't do specific blood tests. But when you see yellow eyes, doctors will go, ka-ching, I've got the answer. But when they don't see yellow eyes, they call it malaria, they call it typhoid, we call it flu, so many different diagnoses that may not be correct.
All right, let's look at the preventive measures. What are those things that can be used to prevent, or how can we prevent hepatitis? And once one is down with hepatitis, what's the next step to take?
Very good question. And this goes to what you asked me earlier on.
Okay.
Different age groups, and any age group can suffer from hepatitis. So how do we stop it in children, for example, or in babies? You vaccinate them. So right now, if we start vaccinating children against hepatitis, in 10, 15 years' time, when they become young adults and become sexually active, we've already now created a vanguard of people who don't have hepatitis, so they can't transmit it and they can't be infected with it. So as they grow into adulthood, we have a clean population, if you see what I mean. For teenagers, we need to tell them there is hepatitis out there. Same as there is HIV and AIDS, they need to prevent catching sexually transmitted infections by using protection. And adults, older people, just check Go do a blood test to see whether you have suffered hepatitis in the past before, and you're still carrying the virus, which may mean that you can have some treatment because it can actually damage the liver long term. Or if you haven't had hepatitis, you're still negative, which means you still have some risk. Then get vaccination. So it's actually quite simple, 3-pronged attack. Vaccinate babies, prevent them when they go into adulthood from either catching or transmitting the infection. Teach teenagers now about protection.
All right.
And then check adults.
All right, talking about the vaccine, we know what happened during the meningitis type C. We didn't have the vaccine. For this, do we have the vaccine readily available? Does Nigeria produce it, or can Nigeria produce it?
Nigeria can produce whatever we want to produce, so long as the government is actually ready. Oftentimes what happens is that we're waiting for other organizations, other countries, other people who are interested in, for example, hepatitis, to come here and say, hey, Mr. Government, here's the money to sort your people out. That's not the way it should be. We should have huge amount of budget for health to deal with this kind of issues for Nigerians, because it's our problem. It's not the UN or WHO or America, for example, who will say, here's a few millions to start looking for hepatitis in your country. It shouldn't be the way it is. So we can do whatever we want to do so long as we are serious. And it means we have to be serious as a people, and we have to have a serious government.
Now, talking about vaccines, if an adult takes a preventive vaccine, how long is it meant to last before it wears out? Or how long is it meant to be effective?
Oh, if it's good and done properly and you need to take 3 doses, it protects you for life.
For life?
Oh, absolutely. It protects you for life. So long as you raise the immunity inside you, then anytime the virus comes over, it's going to say, hey, we can't go there. That guy is protected. So adults need to be checked. They need to check whether you're negative or positive. If you're negative, get vaccinated. If you're positive, then we need to find out whether you have the infection in you and you can transmit it. So and then you can protect your loved ones. Yeah? And for those who actually also know, you can have treatment. There is still treatment available.
Now tell us about what the Guild is doing as regards this scourge in Nigeria.
Well, we're going to make as much noise as possible. I mean, that's the key thing. We need to get it into the nooks and crannies of Nigeria. We need to get everybody, whether urban or rural, to know about hepatitis. Information is power, so long as you know. And so people know that if I have a newborn baby, I'm going to think about vaccinating that baby against hepatitis so I can protect my baby when they become adults. And if you're a teenager, you think, gosh, somebody's talked about hepatitis today. Well, I'm going to be really careful and take protection. We've done our job. If adults now think, well, let me just go and find out whether I have this hepatitis that Dr. Ogungbo was talking about this morning, check. It doesn't hurt to check, because if you're negative, you get protection. If you're positive, you get treatment.
How cheap is the test? And how ready where can you walk into get tested?
Well, good question again. You should go to a recognized diagnostic center or a government hospital. Because not every Jack and Jill who has a sign out there that says, I'm a diagnostic center is actually, a proper, recognized and suitable diagnosis. There's so many quacks out there. So you do have to be careful. So you need to go to a recognized center that, can do the test so that whatever results they give you will stand international scrutiny. Because you don't want anybody to just go and cook up results on their kitchen table and say, here's the results of your hepatitis. You do have to go to a government hospital, any of the private hospitals, from the Guild of Medical Directors who say, we do hepatitis tests, we'll do a credible test for you. So those are the things, not just any quacks. Certainly not just anybody in a Danfo or a Molue bus that says, you can do your hepatitis test here. That's a no-no.
Okay. Oh, so is there any activity, to really bring the message home to Nigerians?
Well, we're kickstarting the campaign in eradicating hepatitis in Nigeria at the end of this month. We have a big conference coming up at the end of the month, and we're going to start off on that particular day. But we're hoping that the advocacy will be throughout our generation. Anyway, we're going to keep talking about this because it's not a one-day event. And that's why we need the press, we need the people to actually understand that this is for everybody. It's a fight to the very end.
Okay. Oh, before we let you go, one last advice to Nigerians.
Well, before you give that advice, I have a question for
Yes.
those that are already down with illness.
Yes.
What about their nutrition? What kind of food or fruits should they be engaging in order to help them?
I understand what you mean, and there's no specific food per se, but they need to be under the management of a doctor, and we call them hepatologists. Those are the specialists, hepatologists. Those are the specialists who look after the liver itself.
Right.
And so, if somebody is, has an acute infection right now, they need to be managed by hepatologists. They will know, how to manage the diet, what kind of fluid, how much fluid, whether they need a blood transfusion, whether they need specific immune boosters, to fight, the virus. So, those who are acutely ill now, this thing kills.
Is there a time frame where?
Oh, they need to be treated immediately. But the other thing, of course, is those who have a chronic infection. That means they either don't know they have the infection, or they know they have the infection, that they're managing it. They also need to be looked after regularly. They need to have their livers checked, because hepatitis infection can lead to cancer in the liver. It can lead to what we call the liver cirrhosis, which means the liver becomes shrunken, hard, and horrible. But the key thing is it's not doing its job anymore. And yes, you can have a liver transplant, but we don't currently have that level of skill, to do liver transplant and look after those patients, for a long time.
When you say skill, is it as in personnel or the equipment?
In total, everything. I mean, we are now only just about getting it right with kidney transplants, with heart transplants, those high class medical skills are not commonplace in Nigeria, and to have a liver transplant, it's an expensive business. So unless you really have the money, you can't have a liver.
Okay, all right.
Quite interesting.
You are going to give some advice as regards what's coming up.
I suppose the most important advice is just to be sexually aware and protect yourself, because hepatitis and HIV are real diseases. And these are not diseases that can be cured by the pastor or a herbalist. You need to be seen properly by a trained specialist.
All right. Thank you very much for coming on the show this morning.
So
Let's hope that the awareness is out there and people will really get to know how serious this is. Thank you so much. Well, that was Dr. Biodun Ogungbo on tackling hepatitis in Nigeria.